Basically, we all grew up with this concept. Even from our medical school days, we grew up with this concept, and this concept still lingers on, that diabetes is an irreversible disease. Once you have it, you have it. Basically, that's why the concept was that you try to prevent the diabetes, try to arrest the diabetes in the pre-diabetic stage, and so that it does not progress any further. But what about somebody who has already developed a full-fledged diabetes? So this first thing, that this person with a full-fledged diabetes, they could actually reverse it. The initial positive signals started coming after the bariatric surgery. This was way back in 1999 when some of these first bariatric surgeries done by the Italian group. It actually showed that even in these patients with diabetes, even in the first 1 or 2 days after the surgery, these people who are on a big dose of insulin, the insulin requirement almost came down to zero. So that was one of the first things which suggested that diabetes remission could actually take place. And there was a huge, I should say, a huge uproar was raised, and a huge amount of excitement was created. Then came that Shapiro's islet cell transplants, and where they actually showed that even in type 1 diabetes, you could completely stop these people from being insulin dependent. So everybody was excited, everybody was, very highly impressed by what was happening, but then started coming the pitfalls. So what I'm going to take you through the next 15 minutes to this. So I do not have any conflict of interest. And so when we're talking about remission of diabetes, what is it anyway? The definition is very simple, that reversing diabetes is a term that usually refers to a significant long-term improvement in the insulin sensitivity in people with type 2 diabetes. Actually, this word reversal has mainly been used in type 2 diabetes, but for the sake of discussion, we'll talk about also in type 1 diabetes. And people with type 2 diabetes that are able to get the HbA1c below 6%, this was the sort of a criteria, without taking diabetes medications, are said to have reversed or resolved the diabetes, and this is also known as putting diabetes into remission. So that is remission and reversal. But there is again another small difference, and what is that we're going to talk about right now? So in August 2021, in the consensus statement of ADA, they came up with this sort of a guideline. I'm just trying to pull in the consensus statements of the different August bodies. Well, the first and foremost thing, the exact criteria is still debated. And most agree that HbA1c less than 6 months for at least 3 months without use of any glucose lowering medication is the remission or temporary reversal. Patients has to be monitored at least once annually. This reversal could be of 3 types. It could be fractional, that is less than 6.5 without glucose lowering therapy for 1 year, less than 5.7 without glucose control prescription for 1 year, and it could be prolonged, that is less than 5.7 without prescription for more than 5 years. And for all practical purposes, this would define as a cure. Now, when HbA1c is an unreliable marker, you could use some other methods like the EA1C. Now, this sort of a reversal has been documented in patients following bariatric surgery, or in patients who have had a weight loss of at least 10 kg with a VLCD diet or a bariatric surgery. And there have been also some pharmacotherapeutic agents which have been able to produce some amount of remission in diabetes. So what are these? So what are the promises of remission? Now, this is basically the intervention, the factors defining the remission and reversal of type 2 diabetes. So there are basically 3 factors, or the 3 pathways which we can follow. One is a pharmacotherapy, and here the definition is that at least 3 months after the cessation of the intervention, and the subsequent measurement of HbA1c should happen not more than once every 3 months or less frequently than once yearly. So this is the strict criteria that you have to follow. The other one is surgery, that is at least 3 months after the procedure and 3 months after the cessation of any pharmacotherapy. For lifestyle, it's a little longer, at least 6 months after the beginning of intervention and at least 3 months after cessation of any pharmacotherapy. So these are the ones which are the, or I should say these are the strategies which are followed for identifying diabetes remission or reversal. Now these are some of the few things which we all know. The gestational diabetes, once the pregnancy is over, the diabetes it's gone. Steroid induced diabetes, you stop the steroid, the patient becomes all right. Secondary diabetes, you correct the endocrine cause, the patient becomes all right. Stress hyperglycemia due to sepsis or an acute MI, the stress factor over, it goes away. And these things are usually the last 2, for example, the steroid induced diabetes and the stress hyperglycemia is usually due to increased insulin resistance that reverses with the treatment of the causative factor. And as soon as that factor is corrected, we expect the things to become all right. And an unexpected reduction of body weight is something which has also been shown to reverse diabetes, either by the patient himself or through any other methods. So what are the promises that we are talking about? So this was one of the studies which showed, this was a Chinese study. Now we know anything Chinese, we have to take them with a pinch of salt. But again, this was a Chinese study, not a big study, around 380 patients. Patients divided into 3 groups. They were newly diagnosed type 2 diabetes patients and given this intervention. So one was the oral glucose lowering therapy, one was the multiple dose insulin injection, and the third one was the CSII, the continuous subcutaneous insulin infusion. So the remission rates, these patients were followed up for more than 1 year. And what they found out was that in the first group, there was a 26.7% remission. But in the last group, that is CSII, there was a complete remission in more than 50% patients. And this was the thing which actually got everybody interested. And what was noticed was in the last 2 groups, the people who were on either multiple dose injections or in the continuous subcutaneous insulin infusion, the first phase insulin response, which is one of the hallmarks of a functioning beta cell, this was preserved in these 2 studies. Afterwards, there have been several meta-analyses on this short-term insulin therapy as a way of reversal of diabetes. So this is a meta-analysis that I'm presenting here. It showed that the drug-free remission was around 66% at 3 months, around 59% at 6 months, but then gradually, the more the duration, the less number of people were in the remission stage, which obviously first time raised this question that this remission is not permanent. It is probably going to come back. And all but one study showed that an improvement in the beta cell function as assessed by the homeostatic model assessment it's definitely there. So the beta cell function did improve with this treatment. And there was a significant insulin resistance reduction was also shown by this same method. So this was, but at least this raised this issue that it is definitely, I should say, there's a substantial reversal of diabetes in a large number of patients. These are the proposed mechanisms: beta cell dedifferentiation to progenitor cells, strict monitoring and normalization of blood glucose by the insulin therapy, and restoration of the drug responsivity. So these were all pathways. And some other drugs which were also shown in subsequent studies to actually contribute to the remission of diabetes. GLP-1 receptor analogs, there have been studies with SGLT2 inhibitors, some questionable studies on metformin, and again effects of weight reduction with drugs like orlistat. This is the million-dollar question: can testosterone replacement prevent diabetes progression or reverse type 2 diabetes? Just about a year ago, when we presented our consensus statement on the testosterone replacement in type 2 diabetes with functional hypogonadism, I came across this paper. This was known as the T4DM study, which was basically testosterone in diabetes trial. So basically what is a known fact is that men with low testosterone have an increased insulin resistance, which is one of the root causes of type 2 diabetes mellitus. And testosterone replacement for 2 years in this particular trial, the T4DM trial, they showed that it significantly reduces the visceral fat, increases the muscle mass, and reduces the incident type 2 diabetes. And it can also reverse the DM. And this is the hard evidence you can see. Please look at on your right side of the panel, and you can see in this group of people, around 31% patients of type 2 diabetes had diabetes at the end of 2 years period, whereas around 45% of the people on placebo. So obviously, compared to placebo, there was a significant reduction in the incidence of diabetes following testosterone replacement therapy. And if you really have to think about reversing diabetes, again, the data is just restricted to only 2 years. I'm not aware of what happened because this paper came just out in last year, so they need a longer study to find out what exactly is happening in such patients. So because this is exactly where the glimpse of hope has always been there with the reversal strategies, the initial 1 or 2 years very bright, but then actually becomes less and less encouraging. So what about the pharmacotherapy, islet cell and pancreatic transplant pitfalls? Now, when we're talking about diabetes, essentially remission, we're talking about this. For type 1, we're talking about a pancreatic transplant or an islet cell transplant. For type 2, we're talking about the bariatric surgery and diet. So this is the basic principle. What exactly we're finding with the pros and cons of this beta cell therapy? Either you go for a pancreas transplant or a bionic pancreas or an islet cell transplant. If you look at the con side, you can find there are lots of problems here whenever you're going for an islet cell transplant or a pancreatic transplant. The biggest problem is with the risk of the immunosuppressant therapies. And what is more interesting is that a lot of these immunosuppressant therapies actually are diabetogenic. There is this concept of the new onset diabetes after transplant, which is principally studied in patients with renal transplant. But this is this thing, this is a sort of the regime which is following islet cell transplant. And you can see here two of the agents, tacrolimus and sirolimus, which have been underlined, they are the ones which can itself produce a new onset diabetes. So it's a self-defeating of the reversal of diabetes. You're giving an islet cell transplant, but just to preserve that islet cell, you have to continue the patients on these immunosuppressants. The net result is a reversal of this diabetes. So what the ADA in 2021, it suggested, came that given the potential, this was a comment from the ADA 2021, that given the potential adverse effect of immunosuppressive therapy, pancreas transplantation should be reserved only for patients with type 1 diabetes undergoing a simultaneous renal transplant, with and particularly for those with recurrent ketoacidosis, severe hypoglycemia, giving intensive glycemic management. In other words, in a type 1 diabetes patient where even giving a continuous insulin infusion cannot prevent the episodes of DKA, these are the patients who should be subjected to an islet cell transplant. So this guideline has become very clear now. And not only that, if you look at this particular data of the islet cell allotransplantation, this is basically from several countries, from Australia, the United Kingdom, and from the NIH. And what we can see here, that there is an attrition. If you look at these figures very carefully, there is an attrition of the insulin dependence with time. Available series suggest that between 10 to 15% patients, or approximately half of the rates, it is achieved. It goes down, and you can see here, this is the areas which is very important. Insulin independence after 1 year, practically non-recordable in a large number of studies. Some of them have shown maybe 50%, but it's very not at all consistent. There's a complete lack of consistency, and it is not even worthwhile. So for previously non-diabetic patients undergoing a 70 to 80% pancreatic resection, even if you give them this sort of a pancreatic transplant or an islet cell transplant, it's not going to sustain. So that's why that's a sort of a, I should say, death nail on the reversal of diabetes following the transplant. What about bariatric surgery and reversal of diabetes? What are the promises? So basically, this was a retrospective study done on 89 obese type 2 diabetes patients undergoing bariatric surgery from 2009 to 2011. Mark this timing. Till 2015, we were very optimistic that reversal of diabetes could take place, but not so much anymore now after 2015. So this inclusion criteria was an HbA1c more than 6% and an HbA1c value measured 3 months after surgery. And post-operative HbA1c values within the first 2.5 years after surgery, with the median range being 11 months, with the range being 3 to 29 months. And reversal was diagnosed as an achieving a post-operative HbA1c less than 6.1%, and the diabetes duration was grouped as short, less than 4 years. So that was a pre-existing duration of diabetes, less than 4 years, between 4 and 8 years, and more than 8 years. So this is how they were sub-classified into it. Now, what were the results? Overall, around 48% patients were able to achieve a remission of HbA1c less than 6 years, and patients achieving more than 25 kg loss, 61% had diabetes reversal, less than 25 kg, 41%. So weight loss was definitely something which was directly proportional to the changes in HbA1c, and this remission in 62% patients was less than 4 years in diabetes of shorter duration, 56% with the medium duration of diabetes between 4 and 8 years, and 26%. So obviously this was another factor. The lesser the duration of the diabetes, the more the chance of the reversal. So this was a sort of thing, and this degree of achieved weight loss appeared to have been an important contributory factor here. And the results you can see here, I'll not get you through this, but you can see here there was a substantial weight loss and a direct reduction of the HbA1c and the sort of remission that we are talking about. What about the lifestyle modification, the reversal? This was a look-ahead trial which was published, I think, last year. It's a randomized control trial on more than 5,000 overweight patients of overweight or type 2 diabetes. And the target was weight loss of more than 70%, 7% at baseline, and increased physical activity of at least 175 minutes per week of moderate activity. The calorie target was around 1200 to 1500 calories per day for patients weighing less than 250 pounds, and 1500 to 1800 calories for patients weighing more than 250 pounds. Fat should constitute less than 30% of the calories, less than 10% from saturated fat, minimum of 15% calories for protein, and the initial duration was 4 years, further follow-up for 4 years. And you can see here the data from the look ahead, what it suggests. For the first 12 months, there was a substantial reduction of weight and a substantial reduction of HbA1c, even to the point some of these tips actually dipped below 6.1%. So you can see, we could say that this was probably a reversal But lo and behold, after 6 months, it started climbing back again. So obviously, the look ahead or the diet reduction, it did not give to the solution. So if we review these pitfalls again in type 2 diabetes, the bariatric surgery and the diet that we are talking about, look at the criteria eligible people for the bariatric surgery. Even if I assume that bariatric surgery is a successful way, what about the selection patients? In most of the studies, they included patients who were young, more than 65 years. Some of them were not even fit for bariatric surgery. They did not even fulfill that criteria. And a lot of them had contraindications for bariatric surgery. So most of this bariatric surgery data is not, I should say, a very perfect data in that sense, because it showed a lot of discrepancies in the inclusion criteria. And what suggests, this was a damning statement from the ADA 2021, that available data suggests an erosion of diabetes remission over time. 30 to 50% or more of these patients who initially achieved remission of diabetes subsequently experience a recurrence. So that's the bad part of the story. Another meta-analysis comparing the bariatric surgery versus medical obesity, and this was the net outcome. Obviously, with bariatric surgery, the diabetes remission is more. It is much less with medical. But again, as you can see, it's not sustainable. It doesn't remain in the same range. Another study which looked at the very low and the low calorie diets, and what you can see here is that remission that is less than 6.5% diabetes and no diabetes medication at 12 months, the figure was absolutely non-significant. So the only take-home message from this is that after you've had these procedures done, be it islet cell transplant, be it bariatric surgery, be it lifestyle modification, the benefits on the whole, they do not last more than 12 months. So that is the pitfall of this theory of remission and reversal. And not only that, a reduction of the dietary carbohydrate is significantly concerned with an increased mortality. As you can see here, if the energy from the carbohydrate is very high, this is a sort of a U-shaped curve. If the energy from the carbohydrate is very high, there is also mortality. If it is too low, there is also mortality. And what is more important is the thinking that you can get rid of diabetes can be destructive in unexpected ways, because many patients end up with this false expectation that my diabetes is gone. And afterwards, they stop taking the medicines, they do not come for follow-up, and this neglect can be very, very costly for such patients. So the final take-home message from the ADA Consensus 2021, the term seems to describe a sustained metabolic improvement in type 2 diabetes to nearly normal levels should be remission of diabetes and not reversal of diabetes. So this is the first and foremost thing. Remission should be defined as a return to HbA1c less than 6.5% that occurs spontaneously or following an intervention that persists for at least 3 months in the absence of glucose-lowering pharmacotherapy. It's a good idea, it's an encouraging idea, but patients should not lose or they should not actually miss this conception that diabetes can come back again. And it usually does in the majority. And when HbA1c is an unreliable marker, we can use other methods like the E1C calculated from CGM values as an alternative criteria. Testing of HbA1c to document a remission should be performed just prior to an intervention. So if the patient is going for a bariatric surgery, you should check the HbA1c before the surgery and at least 3 months after the initiation of the intervention and withdrawal of any glucose-lowering pharmacotherapy. Subsequent testing to determine any long-term maintenance of remission should be done at least yearly thereafter. We can only say the patient has gone into reversal. I'm not saying this reversal doesn't happen, but it doesn't happen in the majority. So together with the routinely recommended mechanisms, they should be monitored at least once every year. And reversal of diabetes remains a distant goal till date. That's the unfortunate take-home message. Thank you very much.
Thank you, Dr.